Pigeons. They're everywhere, right? A fixture in pretty much every city on the planet. We walk past them every day, maybe toss them some bread, maybe shoo them off a ledge. But what if I told you that this familiar bird carries a hidden and sometimes fatal risk? Okay, let's get into it.
This story, shared online, is absolutely heartbreaking. A man, a total non-smoker, no history of lung issues, suddenly dies from severe lung failure. And the suspected cause? It was right outside his window. His entire balcony was just covered in pigeon droppings. So how on earth can a common city bird lead to something like this? It's a shocking question, and it's the one we're going to answer today. How does something so common, so seemingly harmless, end up having such a devastating outcome? Well, the answer lies in how our own bodies can sometimes turn against us. To really get a handle on the science here, we have to start with the human cost. That story we just heard, it's just one voice in a whole chorus of sudden, completely unexpected loss, all linked back to these birds. And believe me, that story is far from a one-off, not even close. We found account after account of similar heartbreaking losses. A family member dying out of nowhere, a mother's death from pulmonary fibrosis, with doctors pointing the finger at pigeons, a partner passing away after finding dead birds inside an air conditioner. It's just over and over again, this clear and devastating pattern starts to emerge.
So what is this condition? What is this thing that seems to strike so suddenly, yet it's caused by long-term exposure? Well, doctors have a name for it, and it's a disease that's really good at hiding in plain sight, often getting misdiagnosed until it's far too late.
It's called bird fancier's lung, which is a type of hypersensitivity pneumonitis. Now, that's a mouthful, I know, but here is the most crucial thing to understand. This is not an infection. You're not catching a germ from the droppings. No, this is an allergic reaction of your lungs themselves. When someone who's susceptible breathes in these tiny airborne proteins from dried droppings and feathers again and again, their immune system just goes into overdrive. And the symptoms? This is the tricky part. They're so deceptive. You've got shortness of breath that gets worse over time, a dry cough, fever, fatigue. I mean, you could easily mistake this for the flu or pneumonia or, hey, maybe just getting older. But these are the warning signs of a very serious immune response that's happening deep inside the lungs. So let's look at what's actually going on inside the body. How does just breathing in dust from bird droppings lead to permanent, irreversible lung damage? Well, it's like a four-stage battle, where your body's own defense system becomes the enemy. Okay, so step 1, you breathe in these microscopic proteins. Step 2, your immune system sounds the alarm, flags them as dangerous invaders, and launches this massive attack. Step 3, because you're constantly being exposed, that attack never, ever stops. It leads to this chronic, persistent inflammation. And finally, and this is the truly destructive part, your body tries to heal from all that inflammation by creating scar tissue. It's just like when you get a cut on your skin and it scars over, but imagine that happening deep inside the delicate, tiny air sacs of your lungs. This scarring has a name, pulmonary fibrosis, and that's what makes the damage permanent.
Now, take a look at this. This gives us a window into what's happening. This is a chest x-ray of a patient with the disease. You see those hazy, kind of cloudy areas? That's not a normal infection. That's widespread inflammation. That's the lungs in a constant state of battle.
And then you get this. This CT scan is from a more advanced case, and it shows the tragic final stage. You can literally see how the lung tissue itself has changed. It's gotten thick, it's scarred, it's stiff. This isn't just inflammation anymore. This is permanent damage. This is fibrosis. And that is the most critical takeaway from all of this. Once that scarring, that fibrosis sets in, the damage to the lungs is permanent. It cannot be reversed. There's no going back. The lungs lose their ability to expand and contract, making it harder and harder to do something as simple as breathe. So because this damage is so severe and so permanent, and because the source is so common, this medical reality just spills out onto our streets. It creates a huge social conflict. It's a clash between people who see pigeons as harmless creatures we should care for, and those who see them as a direct threat to their family's health. On one side, you have people who believe feeding birds is a good deed, a form of dharma. They see them as harmless animals, and animal lover groups will often protest any attempt to ban feeding. But on the other side, you have residents who have to live with the consequences. They call them flying rats, pests. They're the ones dealing with the awful stench and, most importantly, the profound health risk to their families.
A quote like this, wow, it just cuts right to the heart of the conflict, doesn't it? For someone who has lost a loved one or watched them suffer for years, the act of feeding pigeons isn't just a simple act of kindness anymore. It becomes a personal, deeply felt threat. So, given how severe this disease is and how permanent the damage is, what can actually be done? This final part is all about prevention, because when it comes to bird fancier's lung, prevention is, quite literally, the only cure. And by the way, while bird fancier's lung is our main focus, it's not the only danger. The droppings can also carry some other nasty fungal and bacterial infections, things like histoplasmosis and psittacosis, which are especially dangerous for anyone with a weakened immune system. And here's the tough truth about treatment. Doctors can give you medications like corticosteroids to help reduce the inflammation. But, and this is a huge but, these drugs cannot heal the scarred lung tissue. They can calm down the battle, but they can't repair the battlefield. In the most severe cases, the only real option left is a lung transplant. So the only truly effective intervention comes down to these three things. First, recognizing those persistent, unexplained respiratory symptoms early on. Second, identifying the source, connecting those symptoms to your environment like, hey, are there pigeons on my balcony or near my window AC unit? And third, and this is the most important one, complete antigen avoidance. It means you have to totally remove the source of exposure. That is the only way to stop the disease from getting worse. And so we're left with a really difficult question. The pigeon is a symbol of city life, a wild animal that we live right alongside. But as we've just seen, that close proximity can come at an incredible cost. It forces us to ask, what is the real price of this coexistence? And who is it that ultimately has to pay it?